This presentation addresses the topic of knee pain among electricians and aims to shed light on potential occupational health factors. The information is based on a survey designed to gather data on this issue. Firstly, consider the age of an electrician. Age can be a contributing factor to joint pain and overall physical condition, impacting the likelihood and severity of knee problems. Secondly, the duration of employment as an electrician is important. The longer someone has worked in the field, the more cumulative stress their knees may have experienced due to repetitive tasks and physical demands. Thirdly, examine ladder climbing frequency. Frequent ladder climbing places considerable stress on the knees, contributing to wear and tear and increasing the risk of pain and injury. Fourthly, consider the current experience of knee pain. This question directly assesses whether electricians are currently suffering from knee pain. Fifthly, evaluate the severity of the pain. On a scale of 1 to 10, this question gauges the intensity of the knee pain experienced, providing a quantitative measure of its impact. Sixthly, analyze the duration of knee pain. Understanding how long an electrician has been experiencing knee pain can offer insights into the chronicity and potential underlying causes. Seventhly, assess the perceived relationship to work. This question explores whether electricians believe their knee pain is connected to their job, helping to identify potential occupational factors. Eighthly, determine any previous diagnosis of knee injury. A history of knee injuries can predispose individuals to further pain and complications. Ninthly, explore any prior knee surgeries. Previous knee surgeries can indicate underlying issues and potentially affect current pain levels. Tenthly, gather any additional comments or insights. This open-ended question allows electricians to share any other relevant information or experiences related to knee pain. The primary goal is to collect data from electricians regarding their experiences with knee pain. This survey aims to gather information on various factors, including age, years of experience, frequency of ladder climbing, current knee pain, pain severity, duration of pain, perceived relationship to work, history of knee injuries, and previous surgeries. The data collected through the survey will be analyzed to identify potential correlations and risk factors associated with knee pain among electricians. This analysis can help inform strategies for prevention and intervention, promoting better occupational health and well-being. The survey is designed to be anonymous and should take no more than 5 minutes to complete. This ensures that participants feel comfortable sharing their experiences and that the data collected is as accurate as possible. All data will be kept confidential and used solely for research purposes. The findings will be used to develop recommendations for improving workplace safety and reducing the risk of knee pain among electricians. This research can contribute to the development of ergonomic guidelines, training programs, and other interventions aimed at protecting the health and well-being of electricians. This can lead to improved working conditions and a reduction in the incidence of knee pain and related injuries. The information gathered can be used to advocate for policies and practices that prioritize the health and safety of electricians. This includes promoting the use of proper equipment, providing adequate training, and implementing strategies to reduce physical strain on the knees. Findings from this research can be shared with electricians, employers, and other stakeholders to raise awareness about the issue of knee pain and promote proactive measures for prevention. This can help to create a culture of safety and well-being within the electrical industry. This effort represents a commitment to understanding and addressing the occupational health challenges faced by electricians. By collecting data, analyzing trends, and developing interventions, we can work towards creating a safer and healthier work environment for these essential workers. The goal is to make a positive impact on the lives of electricians by reducing their risk of knee pain and improving their overall quality of life. The survey will provide valuable insights into the prevalence and impact of knee pain among electricians. This information can be used to inform strategies for prevention, intervention, and policy development, ultimately contributing to a healthier and safer work environment for electricians. The data can be used to identify specific risk factors and develop targeted interventions to address them. For example, if ladder climbing is found to be a significant risk factor, strategies can be implemented to reduce the need for ladder climbing or to provide electricians with training on proper climbing techniques. If the research reveals that certain demographic groups are at higher risk, interventions can be tailored to meet their specific needs. This targeted approach can be more effective than a one-size-fits-all approach. The information gathered can be used to develop educational materials and training programs for electricians. These materials can educate electricians about the risk factors for knee pain, the importance of proper body mechanics, and strategies for preventing injuries. Training programs can provide electricians with practical skills and knowledge to protect their knees and maintain their overall health. This proactive approach can help to prevent knee pain before it starts. The data can be used to advocate for changes in workplace policies and practices. For example, if the research shows that a lack of breaks is contributing to knee pain, policies can be implemented to ensure that electricians have adequate rest periods throughout the day. If the research reveals that certain tools or equipment are causing strain on the knees, efforts can be made to find alternative tools or equipment that are more ergonomic. This advocacy can lead to significant improvements in workplace conditions and a reduction in the risk of knee pain. The research can be used to inform the development of new technologies and equipment that are designed to reduce the risk of knee pain. For example, engineers can use the data to design ladders that are easier to climb or tools that are more ergonomic. This innovation can lead to significant improvements in the safety and efficiency of electrical work. The data will be used to track the effectiveness of interventions over time. By monitoring the prevalence of knee pain among electricians, it is possible to assess whether interventions are having a positive impact. If the data shows that interventions are not effective, adjustments can be made to improve their effectiveness. This continuous monitoring and evaluation is essential for ensuring that efforts to prevent knee pain are successful. In addition to the quantitative data collected through the survey, the qualitative data gathered from the open-ended question can provide valuable insights into the lived experiences of electricians with knee pain. These stories can help to personalize the issue and make it more relatable to others. The qualitative data can also be used to identify themes and patterns that may not be apparent in the quantitative data. This holistic approach can lead to a deeper understanding of the issue and more effective interventions. The results of this research can be shared with other researchers and practitioners in the field of occupational health. This collaboration can help to build a body of knowledge about knee pain among electricians and to promote the development of best practices for prevention and intervention. The findings can also be presented at conferences and published in journals to reach a wider audience. This dissemination of knowledge is essential for advancing the field of occupational health. The information gathered can be used to develop a comprehensive plan for preventing knee pain among electricians. This plan should include a variety of strategies, such as education, training, policy changes, and technological innovations. The plan should be tailored to the specific needs of the electrical industry and should be implemented in a coordinated and collaborative manner. This comprehensive approach is essential for achieving long-term success in preventing knee pain. The ultimate goal is to create a work environment where electricians can perform their jobs safely and comfortably, without having to worry about knee pain or other musculoskeletal problems. By working together, we can make this goal a reality. The insights obtained can contribute to broader discussions on workplace ergonomics and safety standards across various industries, not just limited to electricians. The survey data can serve as a benchmark for future research and interventions related to musculoskeletal health in physically demanding occupations. The research can potentially inform the development of new diagnostic tools or treatment approaches for knee pain related to occupational activities. The findings can be used to advocate for increased funding for research on occupational health issues affecting skilled trades. By highlighting the prevalence and impact of knee pain among electricians, we can raise awareness among policymakers and the public about the importance of investing in research that addresses the health and safety of workers in these essential occupations. The research can lead to the development of new resources and support programs for electricians who are experiencing knee pain. These resources could include access to physical therapy, pain management specialists, and peer support groups. By providing these resources, we can help electricians to manage their pain and improve their quality of life. The research can also be used to promote the adoption of healthy lifestyle habits among electricians. These habits could include regular exercise, a healthy diet, and stress management techniques. By promoting these habits, we can help electricians to prevent knee pain and other health problems. The survey findings will be disseminated through various channels, including professional organizations, trade publications, and online platforms, to ensure that the information reaches a wide audience of electricians and stakeholders in the electrical industry. The survey includes questions about age, years of experience, frequency of ladder climbing, current knee pain, pain severity, duration of pain, perceived relationship to work, history of knee injuries, and previous surgeries. Firstly, age serves as a baseline demographic factor. Understanding age distribution allows for analysis of age-related prevalence of knee pain, and it helps determine if older electricians have a higher incidence of knee problems. Secondly, years of experience directly relates to cumulative exposure to occupational hazards, and it helps assess if longer careers correlate with increased knee pain. Also, it helps evaluate the impact of years in the trade on knee health. Thirdly, frequency of ladder climbing is a direct measure of a specific occupational stressor. It quantifies the exposure to a known risk factor for knee injuries, and it helps determine the dose-response relationship between ladder climbing and knee pain. Fourthly, current knee pain is the primary outcome variable, indicating the prevalence of knee pain among the surveyed population. It helps to establish the baseline level of knee pain within the electrician community. Fifthly, pain severity provides a quantitative measure of the impact of knee pain. It allows for comparison of pain levels among different subgroups of electricians. Sixthly, duration of pain helps differentiate between acute and chronic knee pain. It helps identify the long-term effects of occupational exposures on knee health. Seventhly, perceived relationship to work captures the subjective assessment of the connection between job and knee pain. It provides insights into the worker's perception of the causes of their knee problems. Eighthly, history of knee injuries helps identify pre-existing conditions that might influence current knee pain. It helps control for the influence of previous injuries on the relationship between occupation and knee pain. Ninthly, previous surgeries indicates prior interventions for knee problems. It helps account for the impact of surgical treatments on current knee pain. Tenthly, other comments allows for qualitative insights and additional information not captured in the structured questions. It provides a space for electricians to share their unique experiences and perspectives. The goal of the survey is to collect data that can be used to understand the prevalence and risk factors of knee pain among electricians. By analyzing the survey responses, researchers can gain valuable insights into the relationship between occupational activities and knee health. This knowledge can then be used to develop targeted interventions and prevention strategies to protect the well-being of electricians. The survey is designed to be anonymous in order to encourage electricians to participate and to provide honest answers. Anonymity helps to reduce concerns about potential repercussions from employers or colleagues. The survey is brief in order to minimize the burden on participants and to increase the response rate. The estimated completion time of 5 minutes is intended to make the survey accessible to electricians who have busy schedules. The findings of the survey will be disseminated to the electrician community through various channels, such as trade publications, online forums, and professional organizations. Sharing the results will help to raise awareness about the issue of knee pain and to promote the adoption of preventive measures. The surveyed data will be used to identify patterns and trends related to knee pain among electricians. Statistical analysis will be performed to determine the relationships between the survey variables. The results of the analysis will be presented in a clear and concise manner, using graphs, tables, and charts. The survey is part of a larger research project that aims to improve the occupational health of electricians. The findings from this survey will be combined with data from other sources, such as medical records and workplace observations, to provide a comprehensive understanding of the factors that contribute to knee pain.